Hey everyone, getting ready to be amazing nurses out there. We are going deep on something that's going to be a big part of your nursing careers, no matter what area you end up in. Palliative and end-of-life care.
That's right. And we've got some great insights to help you provide really compassionate care from a source called palliative.txt.
So let's jump right in. What exactly is palliative care? I feel like there's a lot of confusion out there.
Yeah, it's not always clear. The main thing to remember is that palliative care is about easing suffering and improving someone's quality of life when they have a serious or life-limiting illness. It's not just about the physical stuff, though.
Right, it's more than just meds and procedures.
Yeah, it's about taking care of the whole person, their emotional, social, even spiritual well-being. So
Yeah.
as a nurse, you could be the one who makes a patient's final days more peaceful. That's pretty powerful, right?
Absolutely.
But-
Now, how about hospice care? It seems like everyone thinks that's just for people in their final days, like you go to a special hospice place when you're about to die.
Well, that's a common misconception. Hospice is more like a philosophy of care, not a specific location. It's given by a whole team. Doctors, nurses, social workers, chaplains, sometimes even volunteers. They all work together.
So it's like this full circle of support around the patient.
Exactly. And while hospice is often provided at home, you can also find it in hospitals or long-term care facilities. What matters most is that hospice is for patients who have made the choice to stop focusing on curing their illness and instead focus on comfort.
That makes sense. And in palliative.txt, I saw there are two main requirements for getting on hospice. The patient has to choose it themselves, and two doctors have to agree that the patient probably has 6 months or less to live.
Yep, that's right. But even though we are talking about shifting from fighting a disease to providing comfort and support as someone nears the end of life, we still can't forget about their physical needs, right?
Yeah, for sure. How do we make sure that a patient in their final stages of life is still getting the same quality physical care as any other patient?
Well, first we got to remember the basics. Oxygen, nutrition, pain relief, taking good care of their skin, and helping them manage elimination. These things can get really complicated as the body starts to shut down.
It reminds me of this case in palliative.txt about a patient who was really struggling to breathe. It was so hard for them, and their family was really upset too. What can we do as nurses to help with that air hunger feeling?
That air hunger feeling is called dyspnea, and it's very common at the end of life. It can be scary for everyone involved. We can give medications like morphine to help, along with oxygen therapy, and we can help them relax using different positioning techniques like propping them up can often make a big difference.
Right, and palliative.txt also mentioned something called the death rattle. Is that what it sounds like? That sounds pretty scary.
It can be, especially for families who are hearing it for the first time. The death rattle happens because of mucus building up in the airways, but it doesn't usually bother the patient, thankfully. To help with the sound and to make sure the patient is comfortable, we can give meds to dry up those secretions.
So we've talked about physical needs, but we can't forget about emotional and spiritual needs too.
Oh, absolutely. And a lot of that comes down to simply being present for the patient. Offer a listening ear, gentle touch, or words of comfort. And sometimes the best thing you can do is just sit quietly with them.
It's about being there for them. A lot of patients fear being alone as they approach death. How can we best support them?
Honestly, just by being there. Being present, being compassionate, being willing to listen. Even if you can't take away their fear, you can help them feel less alone. And it's not just the patients who need support.
I mean, the family's right. They must be going through so much too, seeing their loved one decline like that.
Exactly.
Yeah.
Families of dying patients, well, they experience a whole roller coaster of emotions. Fear, sadness, anger, sometimes even relief. It's just a lot to handle.
Yeah, so how can we support families? It seems like they would need just as much help as the patient.
As nurses, we need to recognize those emotions and just offer support however we can. Sometimes it's listening, other times it's connecting them with resources like grief counseling or support groups. And we have to remember families are grieving too, and their grief is just as unique as the patient's experience.
That makes sense. I mean, everyone grieves differently.
And it's not linear. Grief can come in waves, and sometimes it lasts a long time. So knowing the signs of abnormal grief can really help us figure out who might need some extra help.
And what about us, the nurses? I mean, we're dealing with death and loss all the time.
Yeah.
How do we deal with that emotional burden and keep ourselves healthy?
That's a great question, and one we'll talk more about later on. But for now, just remember that taking care of yourself is super important. It's not selfish, it's essential. If you're not taking care of yourself, you can't take care of your patients.
I can already feel the weight of all this, and we've only just scratched the surface. What else do we absolutely need to know about end-of-life care?
Well, we've talked a lot about the emotional and spiritual side of things, but let's not forget about the physical aspects of providing care, managing symptoms, and making sure the patient is comfortable and maintains their dignity. We could unpack all that ourselves, but I think it would be great to bring in someone who specializes in this area to really walk us through it all. What do you think?
Oh, definitely. I think our listeners would really appreciate hearing from someone who's out there doing this work every single day. I know I would.
Awesome. Let's bring in our special guest. Welcome back, everyone. I'm so glad we could bring in a specialist today to talk about some of the practical aspects of providing end-of-life care, especially for all you future nurses out there who'll be the ones on the front lines making it all happen.
Yeah, it's really important to hear from someone who's actually out there doing this work every day.
I completely agree. So I'd like to introduce a colleague of mine, a fantastic hospice nurse who's seen it all. They're going to help us understand the ins and outs of making sure patients are comfortable and feel respected in those final moments.
Well, we're all ears.
Thanks for having me. It's great to be here.
So we were talking before the break about the physical needs of patients who are nearing the end of life. What are some of the most common challenges you see, and how do you approach them?
Well, pain management is a big one. It's really important to make sure patients aren't suffering, and that means using every tool we have to keep them comfortable.
And speaking of tools, I remember from Palliative.txt that opioids are often used for pain relief at the end of life. But isn't there a concern that they could actually speed up the dying process?
That's a common worry, but it's actually a misconception. Our goal is to relieve suffering, and if opioids are what's needed to do that, then we should use them. We just have to adjust the dose carefully to find the right balance for each patient.
Right, it's always about weighing the benefits of pain relief against any potential risks, always with the patient's comfort as a top priority.
That makes a lot of sense. So besides pain, what other physical symptoms do you frequently manage?
Constipation is a big one. Many medications, especially opioids, can really slow down the bowels. So we often use stool softeners and laxatives to prevent any discomfort.
And I imagine skincare is also super important, especially for patients who are bedridden.
You got it. Turning and repositioning patients frequently helps prevent bed sores. And keeping the skin clean and dry is also crucial.
Good skincare is so important for maintaining dignity and comfort, especially when someone is so fragile.
What about nutrition? How do you
Well,
make sure patients are getting the nourishment they need, especially if they're having trouble eating?
we have to get creative sometimes. We might adjust the types of food we offer, maybe something that's easier to swallow and digest. And if they just can't take anything by mouth, we might consider a feeding tube. But that's always a big decision.
Yeah, the decision to use a feeding tube is not something we take lightly. It's always a conversation with the patient, their family, and the whole healthcare team. We have to carefully weigh the benefits and burdens and always respect the patient's wishes.
Absolutely. What about nausea and vomiting? I imagine that must be really awful for someone who's already weak.
Oh yeah, it's definitely not pleasant. But we have a lot of medications that can help with that, like ondansetron or promethazine. Sometimes even simple things like aromatherapy or ginger can help too.
It's all about finding what works best for each person. So we've talked a lot about physical care, but let's shift gears and talk about the emotional and spiritual aspects of end-of-life care. How do you even start those conversations with patients and families?
It's about creating a safe space for them to share their feelings and fears. I try to listen more than I talk, just offering words of comfort and reassurance when it feels right.
Sometimes just being present with them and acknowledging their pain is the most powerful thing you can do.
I imagine a lot of patients and families want to talk about their spiritual beliefs as they're approaching death. How do you approach those conversations?
It's about meeting them where they are.
Right.
If they want to talk about their faith, I'm there to listen and offer support. And if they're not religious, I respect that too.
Absolutely.
Yeah.
It's not our job to push our own beliefs on anyone, especially at such a vulnerable time. It's about honoring their individual journey.
What about those really tough conversations about death itself? How do you talk to families who are struggling to accept what's happening?
Honesty and clarity are so important. I try to explain what they can expect as death approaches, but I also try to do it with empathy and sensitivity. I let them know that we're going to do everything we can to keep their loved one comfortable and peaceful.
And sometimes it's about helping families understand that letting go can be a real act of love. It's not about giving up. It's about allowing someone to die with dignity and peace.
I imagine those conversations are never easy. Do you have any advice for our future nurses about how to prepare themselves emotionally for this kind of work?
Take care of yourselves. Seriously. Find healthy ways to cope with stress. Exercise hobbies, spending time with people you love. And don't be afraid to talk to a therapist if you need help.
And remember that it's okay to feel sad. It's okay to grieve. Those are normal human responses. Don't try to bottle them up.
So it's about acknowledging those feelings and finding healthy ways to work through them.
Exactly. And that brings us to another important topic, advanced care planning. This is where patients can express their wishes about their end-of-life care, so they have a say in what happens, even if they're no longer able to communicate.
That makes a lot of sense. But those conversations can be kind of hard to start. Do you have any tips for bringing up the subject of advanced care planning with patients and families?
It's all about being sensitive and respectful. I usually start by asking open-ended questions like, have you thought about what kind of care you would want if you became seriously ill?
But the goal is not to push an agenda. It's about giving them the power to make their own choices.
So it's more about opening the door to the conversation and letting them lead the way.
Exactly. And once they start talking, I just listen carefully and try to understand their values and priorities.
It's about respecting their autonomy and making sure their wishes are honored.
Let's talk about DNR orders. Now, these are instructions not to resuscitate a patient if their heart stops. How do you handle those conversations with families who might be struggling with this decision?
We have to make it clear that a DNR order is not about giving up or withdrawing care. It's about respecting the patient's wishes and allowing a natural death to happen.
And we also emphasize that even with a DNR order in place, we're still going to provide comfort care and support.
So it's about reassuring the family that their loved one won't be abandoned even if they're not being resuscitated.
Exactly. We're still there for them, providing comfort and compassion every step of the way.
Wow, this is a lot to process. But it's so valuable for nursing students to understand all the nuances of end-of-life care. It's such a complex and challenging area of nursing, but also incredibly rewarding.
It really is. And as we've seen today, it's not just about the physical side of things, it's about the emotional, spiritual, and ethical aspects as well.
We've covered so much ground today, but there's still more to explore. We haven't even touched on the unique needs of caregivers and how important self-care is for nurses working in this field.
Right. We'll have to dig into those topics in our next segment. So stay tuned for part 3, where we'll wrap up our deep dive into palliative and end-of-life care with a special focus on the amazing people who make it all happen.
Welcome back to our deep dive into palliative and end-of-life care. We've talked about the needs of patients and their families, but there's one more really important group we need to consider: the caregivers. That means family members who are taking care of their loved ones, but it also means us, the nurses.
Yeah, you're so right. Providing care, whether it's by family or professionals, is a seriously demanding job. It can really take a toll on you, both physically and emotionally.
For sure. And palliative.txt really emphasized just how much caregivers do. I mean, they manage medications, they provide emotional support. They're just there. It's like a 247 job.
It really is. And they don't get a lot of breaks. And a lot of times it's invisible work. It happens behind closed doors and people don't always see how much is involved.
Right. It made me think of that story in palliative.txt about the woman who was taking care of her husband who had terminal cancer. She was just exhausted, completely overwhelmed, and feeling really alone.
Sadly, that's a really common experience for caregivers. They often end up putting their own needs aside to focus on the person they're caring for. So it's super important that we as nurses see that and offer support.
So what can we do to actually help these caregivers? How can we make their jobs a little easier and maybe even prevent burnout?
I think the first thing is just to acknowledge their efforts. Let them know that we see them, that we appreciate what they're doing, and that we're here to help.
Yeah, sometimes just a simple thank you can mean the world.
Exactly. We can also connect them with some practical resources like respite care or support groups, or just educate them about what to expect as their loved one's illness progresses. Even empowering them to advocate for what their loved one needs can make a big difference.
And we can't forget that caregivers are grieving too. They're losing someone they love. Their grief might look different from the patient's, but it's real and it's painful.
So we need to pay attention to their emotional needs too. Listen to them, offer comfort, and let them know that it's okay to feel all those feelings.
Absolutely. It's all about creating a safe space for them to just be without judgment.
Okay, so we've talked about family caregivers, but what about us nurses? How do we take care of ourselves when we're surrounded by death and loss every day?
Such a good question. If we don't take care of ourselves, we're not going to be able to provide the compassionate care that our patients and families deserve.
And I know burnout is a huge risk in this field. How can we prevent it?
The most important thing is self-awareness. Notice the warning signs of burnout: exhaustion, feeling cynical, and emotionally detached.
So basically, pay attention to how you're feeling.
Right. And then you have to actually do something to take care of yourself. That might look different for everyone. For some people, it's exercise, spending time in nature, or picking up a hobby. Others find peace through meditation, journaling, or spending time with loved ones.
The key is to carve out time for things that bring you joy and help you detach from the stress of your work.
And if things get really tough, don't be afraid to seek professional help. There's no shame in talking to a therapist or counselor.
Absolutely. It takes courage to reach out for support, and it shows that you're committed to your own well-being.
So for all you future nurses out there, if you feel drawn to palliative and end-of-life care, just know that it's an incredibly tough but also super rewarding path.
You'll have the opportunity to be there for people during one of the most vulnerable times in their lives. You'll be offering comfort, dignity, and support.
You'll learn so much about the strength of the human spirit, and you'll see firsthand how powerful compassion and connection can be.
But remember, it's also important to take care of yourselves. Build a good support system, prioritize your own well-being, and never forget your own humanity.
Because at the end of the day, it's that humanity that allows us to really connect with our patients and make a difference in their lives.
As we wrap up our deep dive into palliative and end-of-life care, we want to leave you with this. It's not about giving up. It's about embracing life, even in the face of death.
It's about finding meaning and purpose in those final moments and helping patients and families navigate this incredibly difficult journey with grace and dignity.
Thanks for joining us on this exploration. We hope it's helped you understand this important part of nursing a little bit better.
And keep learning and growing. The world needs compassionate and skilled nurses like you.
Until next time, take care of yourselves and each other. Remember, the care you provide makes a world of difference.